The Buzz with Jess Lujan.
Welcome back with main studio guest, of course, Senator Dennis Rodriguez Jr. 10 bills introduced in regards to trying to holistically look at and basically face the problems of healthcare in Guam. Before we went into the break, Senator, we're talking about reciprocating and maybe some of the backlash you're getting from this, and what you're intending to do, if one would read, is that these are volunteer basis. They're basically even if you're a physician, a foreign physician over there, a specialist and all that, when you come here, you're kind of like an intern.
That's right.
Basically,
absolutely.
You're interning under a licensed physician out here, right?
Absolutely. So that's, we want to ensure that those safeguards are in place, even if for me personally it doesn't make sense because our physicians send them over there, but we want to respect our local physicians here and the credentialing they had to go through, right? And so we made sure that when we bring over these specialists here, they're under a direction, supervision of a local licensed doctor. We had a medical mission about a few months ago. We brought in a rheumatologist, which we badly need on Guam, which we don't have, and a dermatologist. And I told the foundation, I said, go through the process, go to the board and ask how can make sure everything is on the up and up. So they did, and they were told that there wasn't any authority for them to be able to grant anything, any permit or licensure. And so that was really disheartening for me because that meant our people here, and especially those people that can never afford to go to the Philippines or the States to see specialists, they're the ones who are losing out on this. So these specialists ended up coming, but what we had to do was limit their role to just providing talks, educational talks. So they did that at the medical missions, but if they were able to actually see a patient, talk to a local doctor here and say, this is what this patient may have, you should do this, this, and this testing, or provide this type of treatment plan, they weren't able to do it. So this initiative would allow this to happen, and now we're doing it through a process where, again, our Guam doctors will be involved in.
Senator, when I'm looking at healthcare holistically in general, Guam, I know you labeled this as well. Basically, when you look at socialized medicine and all that, basically GMH is socialized medicine per se, because when you really look at the creation of GMH and the patient's supposed to see and all that, right, is that it's basically anyone is welcome. Everyone's welcome, regardless whether you have the ability to pay. And it's not just on emergency situations. It's treating all patients as they walk into the door, whether they're able to pay or not. And when you started, I remember we covered your clinic, your mobile clinic. We did a couple episodes on that. It took me back to some medical missions that I've seen, in the Philippines and all that. And I said, you got this right, because our population base, although we want to compare it to a lot of, because we're U.S., Guam, USA, although we want to compare it to districts back in the States and our population base and things like that, we can't compare it to those districts. We are ripe for medical missions.
That's right.
As much as we want to deny it, we are ripe. The population, salary base, and all that, the amount of uninsured folks, the people who just, regardless of how low you put the premium, won't be able to come here. What the United States got in agreement with our brothers and sisters of Federal States of Micronesia, they're going to come here for medical care, as opposed to other places that are more expensive, further away. So they're coming here out of necessity. So we're ripe for that. So when we continue to again look at populations or districts in the states that do this, let's get our fees up and all that. I said, so if I'm not paying my $500 bill and you raise my fee to $1,000, what makes you think that I can afford $1,000?
That's right.
And I could not afford 500. So it'll continue to go up. Right. How do you see that? I mean, am I wrong?
No, you're absolutely right. Even our geographical location, it's not like you live in the States. things don't work out in this state, you have that option, to pick up and drive to another state, cross lines and start over there, get better health care or anything there.
Sure.
Here, we don't, it's all that we have. We have to make do with what we have. And to kind of, to make that even a little bit complicated, then, we do have others that come here and expect to use the same system that we're using. And so we got to be able to strengthen that. And really, when you take a look at these initiatives, it's about the root problem, right? And the root problem is we have an unhealthy community. And I'm not just talking about what we eat or how we live our life. The basic stuff of getting our kids immunized. When we went out to these these medical missions that we're doing here, there's 7, 8-year-olds that have never been vaccinated. And that's a problem. They play with our kids. And so when they don't have that access to do that, then that's why our healthcare costs are what it is today. Today, that's why we have a system which everyone depends on, uses, which is GMH, that is so challenged.
Not to mention only that, not only that as well, but if they're not getting, if kids are not getting immunized for 7 years or so. Their parents, when their moms were pregnant, they probably never got prenatal care. And that's where really it's showing us our infant mortality rate is so high on Guam, right? And we heard Dr. Kozue Shimabukuro from GMH talk about the challenges of babies being born and being very sick. That's because the mothers are not getting the inadequate prenatal services, and so this is all about being able to expand access to doctors, and also, as we'll talk about later in next week, is about expanding the access to health insurance. Because that's what we really need, is get more people who can get covered so they can pay for it. But also expand the network provider. Okay. Again, as we're talking about this in regards to the 7 bills that have everything to do with volunteer basis in regards to medical practitioner, whether it be doctors, dentists, I think nurses too as well, right?
Nurses and allied health professionals. But also there's one bill here. It's called the Interstate Medical Licensure Compact. Okay. This is a compact that based in the states, that a group of states have come together and have made it easier for doctors in their own states to be able to go to another state that has some sort of reciprocity. Some doctors talk about reciprocity. So this is now allowing us to be part of this compact, so that if you are a doctor, a physician in New York, and we know them, we want to bring them here, the licensure is much more smoother. Okay. You can come here and vice versa. Our doctors can be able, it's kind of
a reciprocating type bill that of course they would have to get approval from their legislature back there as well.
Yes,
right?
So if their legislature approved for them to be in the compact, then their state would be on. So we need to do that here. So we're doing that, and hopefully that again would expand our network of providers.
Okay. And again, there's always the positive, the support versus the
negative side, right?
The negative side of that. What at this point, because it's early on, and maybe just on the onset, you probably got more resistance prior than reading the context of the bill, right?
Yes.
But in that, what kind of resistance are you getting at this point?
A lot of the concerns, or some of the concerns that we're getting, are from stakeholders who have not really understood what the intent is, right? And so after we have explained to them what the intent is, show them exactly what the bill is saying, then they're more accepting to it. Because a lot of times, when you offer change, there's a lot of resistance, because things are different. So I understand that, but when you get people to understand what the intents are and how we're doing it, and get them involved, then it'll become more acceptable.
And the reason why I'm saying this, right, because when I'm looking at the 10 bills, right, you got about seven, maybe 6 bills that you have a whole lot of people that are co-sponsors.
Yes.
And then you have a couple bills where you're the only sponsor.
Oh yeah. So I did that purposely, because I know that those 2 other bills that we'll talk about next week, the expansion of Medicaid and the transition of MIP to managed care. it's taking some bold initiatives.
Yeah.
You know, and so I wanted to ensure that even my colleagues can review it, understand it, and feel comfortable before I ask them to come
I've got
on.
some resistance as well with
Yes,
that. And you know, I mean,
absolutely.
we talk openly with this, and
Yes.
that's what I like about calling on you. You never avoid my calls.
Yes.
You come in here whether I always agree to disagree
Yes.
with that, but at the end of the day, that's what we elected you for.
Absolutely.
Is that. But no, I appreciate that, and of course, today is just an overview
Yes.
of the 10 bills, and we're going to take